Welcome to Newsmax TV. I'm Ashley Martella. We're very pleased to be joined again by former House Speaker Newt Gingrich. He's very much involved in the dialogue over healthcare reform, and he has a website called Center for Health Transformation. Welcome back to Newsmax, Mr. Gingrich.
It's great to be with you.
Okay, the Democrats say they're committed to having healthcare legislation passed by the August recess. Do you think that's possible?
No, I think that it's clear that it's getting harder and harder as they look at the massive tax increase that their plan would take, and as they look at how deep a disagreement is, even within the Democratic Party, between those who are worried about the deficit and worried about the economy, and those who want to move towards a government-run health plan at any cost. And I think that that tension is going to get bigger, not smaller. So I'm very doubtful that they could pass this bill before the August recess.
Mr. Speaker, the Democrats seem intent on including some form of tax increases in the overall legislation. What do you say to that?
Well, I think it's very odd that you have a general agreement that we spend too much money on health care, almost 17% of the largest economy in the world, well over $2.6 trillion a year, and yet their answer is to cut costs by increasing spending. I've never heard of a way that you cut costs by raising spending. They're talking about adding maybe $1 trillion of additional spending over the next 10 years. If you're going to do that, you have to have massive tax increases. I think they're just beginning to confront how big those tax increases will be, and I don't think the American people will stand for it. In this economy, with 9.5% unemployment and indications that it's going to go up even higher, I think people want a focus on creating jobs, not on raising taxes.
Some advocate taxing employer-paid health benefits. Is that a good idea?
Well, here you are with employers who are doing the right thing, providing health insurance, and we're now going to punish them for providing health insurance by taxing the very insurance that they're providing. That strikes me as exactly backwards. We should be encouraging every business to provide insurance for all of its employees, not discouraging it. And that's why I've always opposed taxing health benefits.
Now, Obama, together with congressional liberals, are intent on including some form of government-run health insurance program in the overall package. What do you say to that?
Well, first of all, at the Center for Health Transformation, which you can go to at healthtransformation.net, we have established a petition drive that says if they do pass a public plan, that every member of Congress and every congressional staffer should be required to get their health insurance in that private plan. If they're going to impose something on the rest of us, they ought to have to suffer with the same thing they're trying to do to us. Second, as a principle, we are deeply opposed to that kind of public plan because it's frankly the first step towards a national health insurance program like Great Britain or Canada. The fact is the government will cheat, the government will subsidize and create special rules, the government will enroll people automatically, and they will inevitably crowd out every private sector competitor, and we'll end up with the whole country in a bureaucratic-led, government-run, red tape-ridden system. So we believe it's much better to give people the ability through tax credits, through vouchers, and through tax deductions for every American to be able to buy health insurance, but to have a competitive market with many different choices that you get to pick so you are in control of your health care.
Is there any model for a government-run health care system that the U.S. should look to as a success?
No, I think consistently when you look at government-run programs, they have long waiting periods. In Great Britain, you're dramatically more likely to die of breast cancer than you are in the United States. In some parts of Great Britain, the death rate from lung cancer resembles the 1950s because the technology is so primitive. In Canada, there are a number of advanced procedures you can't get under any circumstance, and you have to go to the U.S. to get it because the equipment literally does not exist in Canada. I think that people who have experienced the kind of long waiting lines, the kind of lack of access to specialized care, lack of access to the most modern drugs and the most modern technology, generally feel that while there are many things we should do to improve the American system, going to a government bureaucratic model is not one of them.
Okay, let's talk about the issue of rationing for a moment. There are predictions that this would definitely lead to rationing with a government-run system. Explain the dangers of that, please.
Well, first of all, I think the basic moral principle of having a bureaucrat decide what your mother or your daughter or your granddaughter should get in health care is profoundly wrong. I mean, the bureaucrat has no risk involved. They can make cruel and arbitrary decisions. When you look at the level of highly specialized care that people have to have with advanced illnesses, you look at the amount of treatment, for example, that Senator Kennedy got recently. We want a system where every American will have access to that quality of care. We believe you can get to that system by focusing on what we call health-based health reform. We focus on finding the best practices in the country. They're almost always less expensive. They have higher quality outcomes. They involve fewer mistakes and fewer errors. And the result is we believe you can deliver more care with better outcomes, with greater independence and better health at lower cost by moving towards a health-based health reform. Let me just give you one quick example. The Gunderson Lutheran Hospital system in La Crosse, Wisconsin, has the lowest cost of the last 2 years of life in America. It cost about $18,000 for the last 2 years of life. By comparison, UCLA cost $58,000 on average for the last 2 years of life. The difference is a system. The Gunderson Lutheran system has over 95% of its patients with an advanced directive. They have an electronic health record, so everybody on the staff knows what the advanced directive is. They have very strong palliative care to take care of pain and discomfort, and they have a very strong hospice system for people who are in the last stages of life. The result is very high satisfaction with very dramatic savings, with people feeling that they really had an opportunity to live out their life with dignity, and families generally very satisfied. We believe that kind of savings, $40,000 per person, just to take that example, would allow you to have care for every American without rationing, and we think that's the goal we should set.
Mr. Speaker, for those who don't know, please explain what advanced directive is.
An advanced directive is when you decide, while you're still healthy, under what circumstances you want heroic medicine and under what circumstances you want life to take its natural course and to pass away with dignity. Clearly what happens is people generally reach very reasonable and very rational circumstances, and they write out what they want. And most people, particularly when they get older, don't want to go through long periods of discomfort, wired up in a semi-vegetative state with heroic medicine at a time when there are no prospects of recovery. And so people actually are pretty reasonable about dealing with the difficult and complex issues of life when they're allowed to participate and to be fully informed about it.
Has the issue of insurance portability been addressed at all?
Well, that's one of the things we need to look at. When we talk with the insurance companies, they all agree that if everybody was going to buy insurance, you would have a 100% risk pool. You no longer have cherry picking. You could then require insurance companies to offer insurance without any kind of precondition, and you could then guarantee portability. We think that's really important because we want every American to have full coverage for their entire life, really from prenatal care until they pass away. And I think that you can design that kind of system. It requires 2 or 3 fairly big changes, but none of them require a government-run program.
Have you advanced your ideas regarding reductions in costs to any Republicans on the Hill?
We've been talking with a wide range of both Democrats and Republicans. The Center for Health Transformation is a very bipartisan organization. We've been working with Senator Baucus' staff, for example, Senator Whitehead, Senator John Kerry, as well as dealing with Republicans in both the House and Senate. And we really believe that it's possible to put together a coalition of common sense, practical people who want to get to a bipartisan solution that starts by looking at better health, focuses on prevention, wellness, early detection, helps people manage their chronic conditions, and then moves to a health-based health reform of maximizing, looking for the best outcomes in America, learning how to share that with everybody, and having every hospital and every doctor move to an improved, better outcome system. We think that is possible. We've been sharing it very widely on Capitol Hill, and we hope that that'll be a key part of the alternative to a government-run socialized medicine model.
Okay, again, it's Center for Health Transformation. Please give the address again and please repeat that petition.
Sure. Healthtransformation.net is our center, is the site for our center, and we have a petition there that basically says Congress should be under the same rules as everybody else, and if they're going to pass any kind of government-run plan, every congressman and every staff member has to be part of that plan.
Former House Speaker Newt Gingrich, thanks so much for sharing your thoughts and insight with us here at Newsmax.
Thank you.
And thank you for watching Newsmax TV.
Homeland Security advises every family to have an emergency radio. It's essential for severe weather, power failures, even terrorism. Now Newsmax is offering you an emergency radio absolutely free. Just pay shipping and get the radio, plus a free trial subscription to Newsmax magazine. Go online to Newsmax.com to check out the details of this great offer. Get your free emergency radio today. Just call 800-NEWSMAX. Make sure your family is protected. Call now, 800-NEWSMAX.